Hello, and a very warm welcome to all the viewers. This is Professor Sreeram Chaulia, Dean of the Jindal School of International Affairs, OP Jindal Global University. And you are now part of a dialogue series that we have launched recently to think about the nature of the current crisis and its broader implications around the world, and the kind of the moment in world history that we are passing through, unprecedented change, and something that few had anticipated, but it is upon us. So what does all this mean? And this is the whole purpose of this dialogue series. Today I'm very privileged to have on the show Professor Horace Campbell. He is Emeritus Distinguished Chair, Kwame Nkrumah Chair at the University of Ghana, and a very senior Pan-Africanist scholar, and someone who has written extensively on Africa and the world for the last 40 years or longer. And Professor Campbell, his books have been read, reread, cited widely. And not only that, outside the world of scholarship, he has been a community organizer. He's been involved in peace and justice movement, anti-war struggles for many generations, anti-apartheid movement. So he is, in a way, a kind of a fixture in recent intellectual history of Africa and the Caribbean. He's originally from Jamaica, but has spent many years in the mother continent, as we like to call Africa. And personally, for me, he's been a teacher going back almost 20 years. So he was my PhD supervisor, and more importantly, I call him Walimu, which in Swahili language of Southern Africa means teacher, revered teacher. So welcome, Professor Campbell, to this dialogue series.
Well, Sreeram, thank you very much. And this is a very important discussion. And I want to thank you and the Jindal University for initiating this series so that we can use the technology to reach a wider audience to reflect on what is the meaning of this moment in world history.
Very much, Professor. So here we are on the cusp of some big seismic shifts which are already happening as we talk. Coronavirus is not simply a health or a medical problem. It is something that's shaken the very foundations of economy, society, and politics around the world. And so, Professor Campbell, to begin with, why do you think this is happening on such a massive scale? And what are the basics of this shift? I mean, there are many ways of looking at it. One is from a nation state centric point of view, it's showing the US in total shambles, unable to cope with, they're going to have 100,000 deaths or more. The Europeans are really struggling and paralyzed. And China, from where the virus came, has been widely discredited. But yet, the developing world, the global south, is holding. And neither Africa, which has 1.2 billion people as a whole, nor India, which is 1.3 billion people, has really been hammered by coronavirus. We have protected ourselves, we have survived, and we are going forward. So what is that? So that's one way of looking at it, the nation state. The other is, the way you like to do it, which is the nature of the global order or the system of capitalism that has existed for several decades, at least since the end of the Cold War. And are we now, is coronavirus pushing us into something new? If so, what is this moment and where are we headed? And then we'll go to Africa after we first brainstorm on this.
Thank you very much. As you rightly pointed out, and the word that is used most often when discussing this virus is that this is unprecedented in world history. And the nature of the crisis to reflect on the fact that hundreds of thousands of persons have died and that millions have been affected by this virus. And as we speak, on May 20th, 2020, we do not understand this virus. That in spite of the great breakthroughs in science and technology and medicine in the past 100 years, we've had a small virus that is not yet understood. And it tells us, more than anything else, the need for international cooperation when it comes to questions of virology and epidemiology and healthcare for all human beings. That's the first major lesson. The second lesson that we have learned is the complete breakdown of the economic model that has ruled the world for the past 75 years. We have seen that in the United States of America, that has been presented as the model of social and economic organization, complete breakdown. And that breakdown has been compounded by the ideas of who are human beings and who has the right to live. And we've seen in Britain and the United States, what is being played out at the policy level is the idea of herd immunity. That is, the economy is more important than human beings. And so we can have, yes, well, in the United States, 3 million people can die. And so the tragedy of this moment is in the midst of this crisis, where 75% of those who have died in the United States are communities of color, that the racism, chauvinism, and xenophobia has risen its head, and not only risen its head, it has risen its head with arms and weapons. That's a major danger for all of humanity, but especially those in the United States of America. The third point is the international institutions that developed after 1945. I want to mention three of those institutions. The International Monetary Fund, which is the basis for the World Economic Order. The World Trade Organization, which is the basis of the World Trading Order. And the WHO, the World Health Organization. All of these institutions, for the past 75 years, served the interests of the United States of America. In the case of the IMF, it served to justify and legitimize the US dollar as the currency of world trade, so that the United States could manage the international system economically and militarily through the IMF. This crisis has put an end to that system. And in the next 10 years, we are going to be in transition to a new international monetary and currency system. The same can be said for the World Trade Organization. The World Trade Organization had been organized from the GATT round to WTO to serve the interests of the Western powers, so that there was a double standard, that Europeans and North Americans could give subsidies to their farmers. The farmers in India and Africa and Latin America could not survive. And even with that, the negotiations for the Doha round for the past 20 years stagnated. And now the United States of America is seeking to withdraw from the WTO. It will take another 10 to 15 years to find a new health system. A new trading system. The third is the WHO. For the past 30 years, the WHO served the interests of US pharmaceuticals and Western pharmaceutical companies, so that in the period of HIV/AIDS, that had been more profound impact, had a more profound impact on African peoples than COVID-19. The WHO and US pharmaceuticals placed the interests of Western pharmaceutical companies before the lives of human beings. And what has happened in this crisis is the WHO, even in its limited efforts to be even-handed, is facing threats from the United States of America to withdraw and to defund it. So if every institution that we're talking about that has served the international order, UNESCO, the United States has withdrawn from UNESCO. So we're in a transition towards a new international order. And the United Nations temporarily is holding it together. But the African peoples and African descendants, with 54 countries in Africa as members of the United Nations, another 24 countries in Latin America and the Caribbean, they constitute the numerical majority in the world in shaping the new order. And what is positive about this is that the traditions of organizing, coordinating struggles, and fighting racism that came out of the anti-apartheid struggles, the fight for providing generic drugs for HIV/AIDS, those struggles in the past 30 years will serve the peoples of Africa and the peoples of the global South in shaping the new international order that will have to arise out of this economic and social health crisis.
Very, very true. I agree with you, Professor. In fact, the inequalities between the haves and the have-nots, it takes a crisis of disproportion, a fundamental restructuring, only for us to really see this threadbare. You know, just the scale, the point you made about who should live and who should die, that's really become so central to our dilemma. I mean, in medical terms, they're calling it triage. You know, in the hospitals, they're just deciding who should be admitted and who should just be left to die in the corridors or on the streets. But I think this is a bigger issue, even with the economic recovery that's going to come after this, or whatever the rebuilding. The big question remains the inequalities and the haves and the have-nots. But moving forward, now, Africa, as we mentioned at the beginning, has relatively weathered this storm. I mean, compared to most other regions of the world, it's doing well. The casualties have been few as a proportion to the population. The infections have been few. And there is reason to be optimistic about Africa, even though the typical Western narrative has been that it's all full of failed states and broken healthcare systems and, you know, very poor infrastructure, and so it's vulnerable, and, you know, millions are going to die in Africa. That's just not happening. It's not borne out by the evidence or by the practice on the ground. So there are some things that Africa is doing really well in this crisis, and perhaps, like you said, some of this has to do with learning from the past catastrophe of HIV that had disproportionately affected Africa, and the more recent one of Ebola. So some lessons have definitely been learned. And I just wanted to mention a few things for the audience for you to follow up on this. I mean, there are some remarkable instances of African ingenuity that have come forward during the coronavirus crisis. First, in Ghana, where Professor Campbell holds the distinguished emeritus chair, it has come to the world attention that there are something called Veronica buckets that have been installed in every nook and corner of the country, named after a health care official of the Ghanaian government. And what this does is it provides easy hygiene for people to wash their hands and to sanitize and to avoid infections. And this has now become across West Africa. The Veronica buckets are being talked about. Low cost solution. No matter how poor you are in a position to maintain hygiene. Second, in Senegal, also in West Africa, some of you may have read, they have developed a $1 10-minute corona test kit. People are talking about, we need, you know, a lot of the healthcare industry in the advanced countries are saying we need trillions, we need billions to do testing and vaccines and all these things. But on the other hand, a poor country like Senegal has developed a $1 10-minute result-based corona test kit that can prove a solution not only for Africa but for the entire global South, and I dare say even for the Western countries that are struggling. The third one, in Uganda, in East Africa. Solar powered oxygen units have been brought in and are being widely disseminated to manage healthcare and to manage the inflow of patients. Number 4, Kenya, a neighboring country in East Africa. Textile companies, medium and small enterprises have transformed to make record number of surgical masks for use not only by Kenyans but for people across the continent. And if you've seen images of how people are protecting themselves from corona on the streets across Africa, you find those colorful masks that are very unique, that are like handicrafts, and that come out of the local traditions of Africa. And they are not so worldwide. We're talking about some kind of a a scramble to get N95 surgical masks. They're saying that governments and companies are going to die in order to just grab hold of N95 surgical masks. But there's a much lower cost alternative based on frugal innovation, the sort that we see in places across Africa. So my point is, and then there are some institutions in Africa, and I would like Professor Campbell to come in there. The Africa Centers for Disease Control, established just 4 years ago in 2016-17, has proved itself remarkable. So much so that the Financial Times of London, a classic spokesperson for Western liberal dominance in the world, has acknowledged that the Center for Disease Control in Africa has been coordinating with 54 member countries rather effectively and in such a way that the best practices are shared. Many parts of the world, people are saying there's no cooperation, there's no multilateralism, it's all broken. Trump is not in favor, he's fighting with the Chinese have their own agenda. But look, there are some regions of the world that are proving very good at regional cooperation. And the Centers for Disease Control, which comes under the African Union, has proved remarkable in its ability to try and counter this pandemic. So, Professor Campbell, Africa is doing a lot of things right, despite the usual cynicism. So, what does that tell us? I mean, on one hand, you have a crisis of the capitalist world order, as we're talking about. On the other hand, a country like Africa, which had been used for resource exploitation in the past, both of its natural wealth and of its biotech, its genetic materials. Now, where does Africa stand? Why is it doing so well? Firstly, in your view, I've cited a few examples. And second, what kind of a counter example is Africa setting to the collapsing capitalist order?
Thank you. I think the important point one should make is what lessons we can learn from the last depression in 1929 to 1939. The most important lesson from that last depression is that the capitalist countries in the world were able to recover primarily through the intensification of exploitation in the colonies. The intensification of exploitation of the Indian workers, the Indian farmers, exploitation of Indonesian workers, exploitation of workers and farmers in Africa. And Walter Rodney has written extensively on this, on World War II and the Tanzanian economy, how the capitalist powers passed on the crisis to African peasants and workers. Why was that possible? Because they were colonies of Europe. The major difference with this crisis is Africa cannot be exploited in the same way. Why is that going to be important? First, those rulers in Africa who depended on their collaboration with the West have found that they cannot fly out of Africa to go to clinics in Switzerland or London or the United States or India. And so the health infrastructure inside of Africa will have to be reorganized. And that health infrastructure will also come from the changes that will be made in relationship to capital flight to Africa. But the most important point about the COVID-19 and Africa is the level of social collectivism in the village community in Africa. What people forget is that the majority of African people live in the villages, and there are codes in the villages about care. In fact, in Western Europe, the majority of those people who are dying are those who are elderly. In Africa, many of the elderly have died because of the lack of proper health care. So those who have survived on the basis of how the community takes care of them. And that community care is very important in terms of how the society will go forward. Because while we speak about COVID, we have malaria, HIV, Ebola, and are still major crises in Africa. And the point that you've made about the Africa CDC, one must make this in relationship to African healthcare professionals. My daughter is a medical doctor from Tanzania. I sat in a conference call she had on Saturday morning with 149 doctors from Tanzania. And these doctors were in Tanzania, in Sweden, in England, the United States, and in the most remote parts of Africa. And what was clear to me was the level of cooperation and collaboration that is going on between medical personnel across the world from Africa and their counterparts in Africa. So that in the case of the Tanzanian government, where the president has proved to be very foolish and made very foolish statements, that the health professionals in that society, they are carrying forward a level of health literacy campaigns that is helping the average person. And she's told me that what is going on among Tanzanian doctors and health professionals is going on in all parts of Africa. She gave the example of the Ethiopian health professionals and why that collaboration among Ethiopian doctors inside and outside of Ethiopia. And then you add that to the collaboration between African states and the Pan-African sentiments, because those same doctors, whether they're from Nigeria, from Ghana, Malawi, Zambia, Kenya, or Tanzania, they work in hospitals in the United States, Britain. As you know, 80% of the doctors in the United States and Europe comes from the third world. The people who are on the front line. So those persons are also in their spare time using their knowledge to work with persons on the ground in Africa. So the important point that should be made here is that out of the experiences of HIV, AIDS, and Ebola, we had organizations such as the Treatment Action Campaign in South Africa. The Treatment Action Campaign in South Africa organized for health literacy, health mobilization, health organization, and that kind of grassroots work that you're talking about that is going on in Ghana is actually a statement coming from the people to say that you cannot fight COVID without generating clean water for the people. In other words, you cannot be talking about healthcare outside of water, sanitation, mosquitoes. So the COVID-19 is bringing to the forefront the questions of equitable healthcare in Africa and in the Pan-African world. And so the Africans are actually very advanced because it has discredited many of the leaders in Africa. If we take the case of Nigeria, where the principal advisor to the president of Nigeria died from COVID-19. And so the kind of security measures that would be the natural instinct of governments to go to private clinics, they have to generalize the care for the persons and for their community at this moment. So the challenge for Africa is major, because we do not know whether this wave will lead to a second wave or a third wave. We study history, and in studying history, we learned what happened in the 1918 flu pandemic. There were 3 different waves, and the message for African doctors, practitioners, is that Africans cannot treat the COVID as a security or a military issue. It must lead to social organizing and build up the social infrastructure. That is the need for water, clean water for all communities, the need for sanitation, garbage collection, the need for health facilities in all areas, so that we're not only talking about COVID, but I must stress that the amount of persons who are dying from malaria, they do not need to die. And what the Western pharmaceuticals have done is try to use Africans as guinea pigs. I think you read on the news where a French doctor said that we can go and test vaccines on Africans. What the CDC and the African Union is doing is setting up the protocols for collaboration in any kind of tests that will be taking place in Africa among African persons at the present time.
No, that's in fact, this is very crucial, Professor Campbell, because historically, since the transatlantic slave trade going back to 16th century, there have been in the imperial centers always a kind of a fascination for Africa's genome and genetic makeup, because when they took slaves from West Africa to the Caribbean and to the Americas, one of the logic behind it apparently was that Africans are more disease resistant, and the yellow fever or malaria and all these things, they have immunity inbuilt over centuries, and therefore their genetic material and indeed this possibility of them being used to test vaccines, all this is a matter of great concern. And I think you're right. If the African Union is strong, if the governments are strong, and most importantly the communities, you mentioned the social organization, social mobilization, and it's interesting, and I want to mention to the audience that Cuba, which has been facing US embargo for the last 60 years, Cuba continues to support the global south, including parts of Africa, with its doctors and nurses, and they're doing really good. So it's not only as Professor Campbell was mentioning, is not only the Tanzanian doctors or the Burundian doctors, but also they, in collaboration with other like-minded medical professionals around the world, who I think are coming together. So there is also this transnational community, plus the actual grassroots communities in the rural parts of Africa that seem to be working in tandem. Although the point is well taken that we cannot get complacent, and there may be several waves, and we have to be watchful. There's the same situation in India. We have thus far protected lives, but it remains to be seen, and we cannot declare victory on COVID-19 anytime soon. But moving on, Professor.
Could I make a point here about
please.
The international leadership at this moment? Clearly, there's a vacuum at this moment, because the kind of racist, xenophobic leadership that is coming out of Europe and the United States, that is trying to implement sanctions on Cuba, Venezuela, and Iran, especially at this particular moment, is calling for new leadership. And the African Union has made it clear that they will not support any sanctions against the peoples of Cuba or the peoples of Venezuela at this particular moment, especially when Cuban internationalist doctors have gone all over the world. They're in China, they're in Italy, they're in South Africa, they're in other parts of the Caribbean. And for this audience, we must make it clear that Africans and African descendants and people of the global South will not support the xenophobic leadership in the United States that wants to launch a war against Cuba and the peoples of Venezuela at this particular historical moment.
Yes, in fact, calls have been made for on humanitarian grounds that immediately all these sanctions, unilateral sanctions, should be dropped. Debt should be waived. These are some of the things that are very central to this crisis. But it looks like the centers of former, or let's say that like the ones which are in decline now, are continuing to try to use the old tactics of control. But the new world order is not going to really stand up for those kinds of tactics anymore, it seems. But Professor, talking of the economic fallout now, I mean, yes, we have saved lives in much of the global South. I mean, Brazil has been a big disappointment, unfortunately, with the bad leadership and with the misguided leadership of Bolsonaro. But otherwise, most of the global South, we have managed to save lives and have not suffered tremendous casualties like we saw initially in China or in Europe or in the US. So, but now going forward, the doom, the prediction of total doom, Nouriel Roubini is saying this is worse than the Great Depression of the 1930s. So this will mean a lot of pain and suffering. But also, like we had brainstormed during the 2008 global economic crisis, and this is probably bigger than that. So it's also an opportunity to reconstruct the world in a different way, on different principles. So on that point, I mean, where does Africa fit in, and where are we going? I mean, are we all going to suffer a tremendous decline in living standards and well-being for the next decade or so? And what is the way to revive? I mean, even Africa is going to go in. I mean, they're saying, the World Bank now says that after 25 years of continuous growth, Africa as a whole is going to enter recession this year because of Corona. So my question is, how are we going to dig ourselves out of the depression when the West is in a very, very weak position? And on the other hand, China, with whom Africa had booming ties, is also struggling to get back on its feet. And there is the whole question of the Chinese presence in Africa. So what is the path forward for Africa? I mean, I am a big believer, like you, in the continental unity. But even there, the continental free trade agreement and such things are, I think, going to be stalled now as a result of this deep economic depression. So every part of the world is suffering, and they're saying there's not going to be a V-shaped recovery by any means, which means that we are just going down and down and down, and we don't know what is the bottom and how we can rebuild. In fact, this whole model of the GDP growth itself, the fetishism for GDP and all this, maybe we have to rethink, and maybe this is the right crisis to measure progress or recovery through different yardsticks than the usual one of the bubbles or cycles, as they call it. There will be recessions and depressions, but then again capitalism bounces back. How can we now envision a different way moving forward economically?
Thank you for that question. Before we think of how we go forward economically, we must think of how we go forward at the level of ideas. I work in a university. The model on which the university had been built for the past 100 years was shaken in a few weeks. Our university, what is taught, how it's organized, the buildings where students live, how they work, how they interact, they're scrambling because the model of the university, which is totally divorced from the communities that they come from, that is based on the profitability of Wall Street, has collapsed. Africa does not have that problem. In Africa, it's very hard for Africa to go much lower than where they are. Africa can only go forward. The first and most important question for Africa is, how can we retain the resources of Africa inside Africa? The IMF, the World Bank, the World Trade Organizations, they have been institutions to promote capital flight. Africa has lost more than $1 trillion in the past 20 years. The high-level commission headed by Thabo Mbeki show that $50 billion goes out to Africa every year. So Africa is generating capital for the international economy. So the first and most important question that will come out of this is, how can the African peoples organize to stop the ruling elements in Africa from stealing money from Africa? And that theft from Africa is the primary question. The second question is the African Continental Free Trade Area. The African Continental Free Trade Area has been stymied because of the Europeans. France holds on to something called the CFA. And 14 African countries, their currencies are tied to the euro. Now, France has been discredited because of its crimes in Algeria and in West Africa. In fact, the president of France apologized for the crimes that were carried out in Algeria. And in December, France gave up holding on to the CFA. Why? Because the Germans have now stepped in because of the French incompetence to say that if we're going to save the euro, after Britain leaves the European Union, the Germans will have to manage the international economic relations between Europe and Africa, and between Europe, Africa, and the United States of America. And for that reason, Christine Lagarde left the IMF to go to the European monetary system, because the Europeans understand that in the currency wars that are coming, the Europeans will have to intensify its relationship with Africa. But Africans are very clear that they must determine the price of their minerals, they must determine the price of their food, they must grow their food, they must grow the education and health system in Africa. So the social organization in Africa, the infrastructure that is needed for water, electricity, transportation, internet, cell phone. How can Africa launch satellite systems so that they can share information in Africa? Now, our project we were working on is to build a major canal from the Congo to Lake Chad, to reflect Lake Chad, because one cannot discuss the economic crisis outside of the environmental crisis that Africa is facing. So that the motion.
How many kilometers is it, Professor Campbell?
From
the Congo River to the Lake Chad? How many
the water transfer system would be to take 5% of the waters of the eastern bank of the Congo to Lake Chad through the Central African Republic and the Chad River to refill Lake Chad, so that the social and economic crisis in that region, which is bigger than COVID, based on the environmental crisis, can be eased. The governments of Africa that are committed to this project are going around trying to organize what France has organized to stop this project. The question is whether the Germans will work against this project, but the Germans are not clear. And the Italians have been in the forefront of working with Africa. The Italian company has worked with Africa, and now the Chinese are joining. I spoke to the deputy head of the African Union 3 days ago. He said the Americans are now interested in joining into this project because they do not want to be left behind. The point is, Africa is not waiting for Europeans and North Americans and Chinese or Indians to reconstruct Africa. This reconstruction is going on every day in Africa by the ordinary persons. Children in Africa want to go to school, and they want to go to school in a condition where their health and safety is guaranteed. So the push from Africa is to call on countries such as India, call on countries such as Brazil, to establish the International Bank for Reparations and Reconstruction. The International Bank for Reparations and Reconstruction will replace the World Bank and the IMF and set up a new international system where we have independent currencies, the African currency, the Indian currency, the Chinese currency, and the US currency, and the European currency. Now, the plan of the Europeans and the United States is that both countries are fighting with each other over who will exploit Africa because they depend on African reserves to be able to keep the dollar. But the major takeaway from this crisis will be the diminution of the dollar. And what will be the international financial structure that will replace it? And that's where the relations between India, Brazil, China, and Africa will dictate the terms of the international system which will emerge after the next 10 years.
Professor, I think I want to take you up on one point, which is the resources. I mean, we know that going back to from the 16th century onwards, but definitely the 19th century onwards, in the so-called scramble for Africa, we have seen there is a consistent mentality of treating Africa as a terra nullius or as an empty land where the people don't matter, and the buccaneers can come and excavate all the precious minerals on earth and pack their bags and leave. So this plunder, the resource transfer you talked about a little earlier, more than $1 trillion, that is more recent. That's in the era of globalization, so-called globalization of the last 20, 30 years. But going backwards, there's been massive. And you talked about reparations. So in this context, I mean, what is the way forward for this natural wealth of Africa to be a basis for this reconstruction? I mean, on one hand, people are saying, well, the Chinese economy is down, and so big oil economies like Nigeria, Angola, all of them are going to struggle, and they don't have export markets for the oil because the Chinese were buying most of it, and now the Chinese are in deep trouble themselves economically. So they're saying Nigeria is going to face a depression, Angola is going to face a depression. So these resources, and then other possibly the Congo and many other parts of Africa which are rich in resources, commodities that used to be exported to generate growth. I mean, that whole model, I think, has run out of steam now because there's no way to sell these things anymore. They need to remain in Africa and should be able to be turned into higher value add within Africa and generate jobs for African people. Now, this whole resource extraction model seems to have, in a way, this crisis is showing that it has exhausted itself.
Thank you. What can I say? If that model has exhausted itself, who in Africa supported that model? The point that most people have forgotten, that for the past 60 years, Africans fought for independence and they won that independence. More importantly, Africans fought against apartheid and won that battle against apartheid. Some of the members of the audience will not know that 30 years ago, 35 years ago, the West said that the African National Congress was a terrorist organization and Nelson Mandela will die in jail. The Africans mobilized the world to beat back apartheid. The Africans, after beating back apartheid, created African Union. The African peoples want the Union. In West Africa, the peoples of Benin, Niger, Cameroon, they have closer relations with Nigeria than with France, but they cannot trade directly with their currency because of the CFA. And so on the ground in Africa, the peoples are more advanced than their governments, especially those who are tied to Western European governments. And the resources in Africa will be used by African people. Let me give you one recent example. Mm-hmm. Angola lent Chad $100 million. And Chad did not have the money to pay back Angola. You know how they're paying them back? They're paying them back by paying 1,000 head of cattle every year. They'll be shipping to Angola. Angola has a project to enrich its dairy herd and its cattle herd to produce more meat and eggs, and they're setting up farms. So the cooperation and collaboration that is going on the ground in Africa between Chad and Angola is only one example of the collaboration that's going on the ground in Africa between the people of Niger and Nigeria. The point is that the European governments, the Western capitalist countries that have exploited Africa, do not want this cooperation. And that is why they have militarily intervened in Libya. And the military intervention in Libya was to destroy the possibility that Libya would use $200 billion of its reserves to anchor the African currency. We cannot speak about what's going on with COVID without saying, how could Germany have the audacity to call a Berlin conference in 2020 so that they could bring peace to Libya, isolating the African Union and African peoples? This is the dream of the Germans. The Germans will have to apologize for the crimes they've committed against Africans in Namibia. The point is, German intellectuals, they have not come forward to join with African intellectuals to say it's a travesty for Angela Merkel to think that they could call a meeting of the Berlin Conference. Berlin 1885 created a catastrophe for the world. Africans will not accept a Berlin Conference 2020. And what COVID 2020 has told us, that the planning of the Europeans, the North Americans for world domination has collapsed. And the question is, what will replace this? This I want to speak to my Indian brothers and sisters, because India will have a very important role to play in the reconstruction of the world. In the anti-apartheid struggle, Kwame Nkrumah and Nehru understood that India and Africa had to stand together against colonialism. The question is, will the Indian leaders understand that they cannot join with the xenophobic and racist leadership in the United States of America against Africa, against Iran, against Venezuela, against Cuba? So I'm making an appeal to your audience in India, especially the Indian intellectuals, because some of them have been carried away in the United States to join with the racists in the United States against African population. So we need the kind of intellectual leadership that came from Nehru and Kwame Nkrumah within the global South to come out of this social, economic, and health crisis.
Great. Now, audience, I know you've been hearing us patiently. If you have questions, we have the last 10 minutes. So please shoot us. Please type your message in the dashboard to the left or right of your screens, and I can read out the questions, and you can also take them up with Professor Campbell. But while I wait,
while they're answering the question, I want to say something about China.
Yes, please. Very important, because the Chinese presence in Africa, what does this crisis tell us, and what will happen moving forward? Because there has been tremendous interest of China in Africa now, but China is going through its own severe internal convulsions because it was so dependent on the Western markets and all these things. So now, with the virus which originated in China, there are a lot of questions. In fact, people were initially worried that Africa will be severely impacted by contagion because of the large Chinese presence in the African continent. You know, all these Chinese who come to do these giant infrastructure projects, thousands of them across Africa. But luckily, Africa has been spared so far. But what is the way going forward between Africa and China now?
Yes, well, the way going forward is the same message I have just sent to the Indian people, that the Chinese workers, the Chinese small farmers and Chinese intellectuals, must be clear they cannot fall prey to xenophobic and racist ideas. We had the experience in Guangdong where some Chinese workers and some Chinese in neighborhoods were scapegoating Africans. And the African Union made presentations to the Chinese government. And I think that the Chinese leadership will understand that they will have to educate the Chinese people about the nature and relations between the African peoples. But going forward, I see the relationship between China and Africa, China and India, and the global South as being very strong. The Chinese model up until now has been based on integration with Western financial institutions. And the Western financial institutions are the very same ones that are standing quiet when Peter Navarro on Sunday called the virus a Chinese virus. Virus does not go by the name of any country or any society. This virus has shown the need for international cooperation. International cooperation in healthcare is same as international cooperation for environmental care. China cannot believe that they can pass on their dirty industry to Africa. So just as how we are dealing with COVID-19, we'll have to deal with global warming. We'll have to deal with health and transportation and education. So all of these questions are coming to the fore at the particular moment. And I think the African intelligentsia, social mobilization in Africa is much more advanced than in China. The African workers, African intellectuals, African NGOs are much more organized and will provide leadership for the Chinese workers and for the Chinese peasants at this particular moment.
Great. Now, Professor, we have quite a few questions from the audience, and I am going to pick only a few given the time limitations. There's one about an interesting one by a viewer called Rayoman Bhaka. And the question is, sir, how does the presence of American and French troops in the Sahel region against the Daesh affect the pandemic response in West Africa? Now, this is, I think Professor Campbell already mentioned that France and the NATO have mostly, in the name of countering terrorism, have been trying to maintain their colonial presence in West Africa. And then there's also a question about, yeah, this is an interesting question, Professor Campbell, but one of my students, Arshia, and she's saying, do you believe that the way all communities have not been equally affected when it comes to the pandemic will call for more representation in the future? So in other words, they're saying that the fact that the countries of the global south have done relatively better than the advanced countries, does it not call for a reordering and greater representation for us in the new institutions that we're talking about? So first, you may wish to take up the whole question of the Western military presence in Africa and what that's going to do and how that might be related to the pandemic, because they've been saying that even in Djibouti, where they've got bases, that there may be some infections and such things, but it seems like there's something more profound here relating to the Western security and military interventions in some parts of Africa. And the second one is about the question of representation for all of us, peoples of the global south, going forward. We just have 4 minutes, so if we can have a quick response from you, Professor.
Thank you. Let me tell you, audience, about my book, Global NATO and the Catastrophic Failure in Libya, Lessons for Africa in the Forging of African Unity. This book explained the role of France, Britain, and the United States in destroying Libya on unleashing the crisis that we have in West Africa today. The second is about the role of France in West Africa and the Sahel. The French fabricated terror in West Africa in order to guarantee French military presence in West Africa. Now, the question that is not clear, which would have to go back to the United Nations and the international organization is what should be the role of the UN peacekeeping forces in West Africa. And this is where the Indian representatives, South African and the Brazilian representative would be very important. If there are terrorists in West Africa, and one needs to combat terrorists, then one needs to engage with societies that have not been involved in financing these terrorists. And the lessons of France in manipulating terror is that France financed Tuaregs in Libya, let them out into Mali, and then turn around to go to the United Nations to get resources to fight terrorism. So yes, if there is terror in West Africa, then countries of the global south need to come together to say countries in Western Europe that have a colonial history cannot serve in UN peacekeeping operations. Which comes to the next point about the international institutions. If UNESCO is to be saved, if the WHO is to be saved, if the World Trade Organization, I do not believe that should be saved, but institutions such as UNESCO, the World Health Organization, they would have to be changed. The point is they can only be changed by countries of the global south, India, China, the United Africa, Venezuela, Brazil, Cuba, coming together in the non-aligned movement to give the kind of leadership that was given in the fight against apartheid.
Thank you, Professor. Last, I think we can take one more. We have 2 minutes. Arshdeep, one of the attendees, is asking us, are there any negative sides to the new world order that is going to emerge?
Yes.
Because it's like we sounded generally positive that the global south is rising and we protected ourselves from COVID-19 going forward. We're going to be self-reliant and all those things. But are there any negative? Do you see? And maybe it's related to the racism you spoke about earlier. I mean, how do you see all these negative trends going forward into this new world order that's emerging? And maybe we can close with that. Yeah.
Well, let us take lessons from the last depression.
We lost Professor Campbell for a moment.
We had from the last depression is that the depression was resolved by war. The reason I wrote this book, Global NATO and the Catastrophic Failure in Libya, was to draw lessons from the Italian invasion of Abyssinia in 1935. The belligerent statements coming from the government of the United States towards China, towards Venezuela, towards Cuba, towards Iran, tells the world that the political leadership in the United States of America, some of them believe that this economic, social, and health crisis can be resolved by war. Again, this is another reason why we need vigilance. In the United States of America, there's already a racist war against communities of color. 2 months ago, another Black man was shot down in the street. So this war is going to be based on racism, chauvinism, xenophobia. Again, where will India stand if the United States is launching a war against the people of Iran or against the people of Venezuela? This is the most frightening aspect of this economic crisis, and we must organize as much as possible to stop wars. In Africa, the African Union dedicated 2020 to bringing peace in Africa. 2020 was dedicated to silencing all guns. How can we internationalize this question to bring peace to Syria, to Iran, to demilitarize the relations with Venezuela, with Cuba? These are questions that we are calling on Indian intellectuals to join with African intellectuals to work towards global world peace. Very
true, Professor. In fact, we can close on that note with the history. We are wiser in hindsight, and we know the fact that Great Depression ended in World War II. So if this is the greater depression, as Nouriel Rubini says, if we are on the cusp of the this great moment of major like an inflection point in world history, then we need to be watchful about wars, which could be a means by which the status quo powers will try to prevent this shift, this momentous shift that we are witnessing. I want to thank all of you for being part of this very engaging discussion. And the dialogue series at Jindal School of International Affairs continues. Special thanks to Professor Campbell for your words of wisdom. And I hope that this conversation will echo across Africa, across Latin America, and across the global South, as well as those in the richer countries who are open to seeing the possibilities of this new world order. Thank you very much.
Thank you for having us.
Thank you, sir.